Citadel, Sable Island.
Mr. Speaker, my question is for the Minister responsible for addictions and mental health. We have seen too many tragic consequences from the lack of supports available for people in acute mental health crisis. Yulia Adrichuk tragically died last year after failing to get adequate mental health care. In the weeks before her death, her parents say she went to the hospital for help because she was struggling and waited 3 days to see a specialist. She died after showing up for an appointment that she was told was canceled, and I've tabled that document previously. Mr. Speaker, can the minister see that so much more needs to be done to support people in acute mental health crisis?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I thank the member for the question. I'm certainly deeply sorry to hear about that story. I don't know the specifics that led up to that case. I do know there is a review going on right now at Nova Scotia Health, and there is an expectation that answers will be provided to the family. But in regards to crisis services specifically, this budget does have an expansion of day hospitals to Cape Breton, to the Western Zone, to the Northern Zone. There will be an expansion of integrated youth services across the province over the next 4 years. So I know that's something the member opposite is very passionate about as well. So I think this will help our children across the province. So there's a variety of items to point to in this budget that are ongoing that will help our youth, and I'm certainly focused on implementing these across the province. Thank you, Mr. Speaker.
The Honourable Member for Halifax Citadel, Sable Island.
Mr. Speaker, the budget does have some money for an emergency mental health crisis response pilot, something our caucus has been pushing for, and for an additional acute mental health hospital. But it doesn't have enough invested in emergency mental health care. We need investments rapidly in acute mental health supports across the province before another tragedy occurs. I was glad to learn about the acute day hospital projects, but what does the minister have to say to someone who's struggling in Liverpool or Kemptville and can't access the same kind of care?
The Honourable Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I know I spent most of my professional life before I worked in this position working in acute mental health inpatient settings, so I certainly know the demand when someone's in a crisis. I do think the expansion of day hospitals across the province will have significant impacts on helping the pressures within the system. There's certainly the integrated youth services has been a file that has been sitting on a desk, I think, for 10 to 12 years. So the IWK and Escazoni have been doing some great work in this regard as well. So we're really trying to get resources not only just within the hospital system, but also within communities to help people before they get to the point of crisis. Thank you, Mr. Speaker.